Welcome to ClaimTech Systems DentOffice Dental Management Software, the new industry leader with built-in cost-saving elements to help manage any dental care business or to interface seamlessly with your outsourced billing professional. For demonstration purposes, we'll log into the demo practice database, but you may choose from multiple practice databases here if applicable to your practice. Your data is securely protected, usernames and passwords easily set or updated by a chosen administrator. We'll begin in the schedule of today's appointments. Planned appointments created during charting are easily sent to the pin board to be dragged into place when scheduling planned procedures. Simply hovering the mouse over an appointment displays the appointment details, contact information, and confirmation status. A double click on the appointment allows their status to be changed to notify of their arrival. The audit trail tracks all changes and the time of the change to record patient waiting time for efficiency analysis. Appointment times are easily and quickly changed by returning it to the pin board, selecting the new date, and dragging into place or sent to an unscheduled list until a new date can be determined. No duplicate data entry is necessary. DentOffice is extremely user-friendly and logical. Program modules are displayed on the left, and most action within the module opened and created here at the action bar. Patient demographic information is contained in the Family module. Double-clicking on the demographic grid displays the entry frame. In addition to basic information, all contact information and contact preferences are indicated here. Providers can be defaulted for the patient or chosen at each visit. By clicking that the information is shared by family members, re-entry is eliminated. Insurance coverage is created here. Policy information is entered. Electronic payer submission IDs are chosen from a preloaded database included in each DentOffice installation. Benefits and eligibility are entered in this area by a double click on the grid. DentOffice also allows for ADA 2006 and 2012 forms, as well as professional or institutional medical claims creation. Once demographic and insurance information is entered for one family member, all shared information pre-populates any additional family members as they're added. As you can see, the Smith family members are listed above for easy access during their visit. Adding another family member is simple and quick, with only the first name, gender, date of birth, and contact information left to enter. Adding insurance is another extremely simple task, with only the relationship to the subscriber left to be entered. We'll move next to the Chart module. Patient charting is quick and familiar in DentOffice. Tooth graphics display clearly and are as entirely easy to effect as if the colored pencils were in your hand. Previous work can be indicated by choosing Existing Other or Existing Current Provider, Today's work by the defaulted current date and complete status, and plan work noted as treatment plan. The tabs next to the tooth chart give fast access to creating the patient's existing chart in no time. Missing teeth, movements, primary teeth if applicable, and the Draw tab gives you complete control of exactly where you want to make a note. Planned appointments are created here, and as previously mentioned, easy to send to the pin board for the front desk to set in place when checking the patient out at the close of today's appointment. The provider maintains full control of patient treatment record and future directives. Again, at the action bar, a new prescription can be entered, as well as lab cases managed, perio charting, and your custom consent form created for patient signature and recorded in the notes. Procedures are added to the progress notes by simply selecting the tooth and the surfaces, typing in the procedure code, or searching the code set at the Procedure Codes button, or quickly access often used codes by custom preset quick buttons. Once your procedure displays, it can be double-clicked to add or sign notes. The tooth chart display can be enlarged for patient education. Once all visit notes are entered, move to the Treatment Plan module in DentOffice to create any necessary pre-authorizations. Simply choose the requested procedure or procedures from the Plan Procedure list by highlighting, then move to the Action Bar Pre-Authorization button. All available insurance plans for this patient display in order. Select the primary coverage, the patient's relationship to the subscriber, and this opens the pre-auth frame. If the procedure is a prosthesis, it would need to be determined if initial or replacement when the procedure note was created, and it must be selected again in this frame, in this area. And of course, adding the date if it's a replacement. Any additional x-rays or documents required are indicated here so that they may be electronically attached during claims processing. By clicking OK, the pre-auth is created, and as you can see, its status is waiting to send, as opposed to the previous pre-auth, which has been sent. In the action bar, you may also save the treatment plan, print the treatment plan, email the treatment plan, or officially sign the treatment plan. We'll move next to the Account module in DentOffice, where all completed work waits for claims creation. All completed procedures, claims, insurance, and patient payments display here chronologically. You may note that treatment planned will not appear here until the pre-auth is returned with its approval number, procedure performed, and set as complete in the record. Only then will the procedure move into the Account module, ready to be noted with that authorization number and sent as a payable claim. To create a claim in DentOffice, all included procedures should be highlighted, then move to the Action Bar New Claim button. You can see that this frame is identical to the pre-authorization creation frame, except for one difference. Here, DentOffice indicates that this is a primary claim as opposed to being a pre-auth. If this were a created procedure which had been approved by the payer, the pre-auth number would be entered here. Today's visit was only for a filling, so there's no pre-approval needed, and this box remains blank. There should be no additional information needed here unless, again, the visit contained any prosthesis to be noted in the bottom Additional Information field, as in the previous module. As you can see, DentOffice even catches oversights, as displayed here, because the relationship to the insured had not been indicated. Claims are much less likely to be submitted with missing or incorrect information. All claims and pre-authorization requests are now sitting in DentOffice's Manage module, waiting to be submitted for processing. In this module, claims and pre-auth requests are sent, statements are generated, supply order requests created, tasks are assigned, and the DentOffice Communications log manages in-house messaging or connects your professional outsourced biller to your office without tying up your phone lines. The employee time clock is located in this module, as well as forms, labels, alerts, and a wide range of customizable conveniences. Your office and your day will flow smoothly. DentOffice is efficient, and it's quick to train for each new staff member. Claims transmission is generated from the Send Claims button. All waiting claims and pre-auth requests are gathered together here, awaiting final verification before sending. You'll notice that once again, DentOffice catches low-level errors that can be easily corrected prior to submission. In this case, a required attachment is missing. And on the medical claim, DentOffice detected that the mailing address of the practice on that claim was mistakenly chosen instead of the physical location. If a claim needs to be visually inspected, a double click will display the claim form data for review. Once all claims are deemed verified and ready, they're highlighted, sent, and automatically transferred to the history list, where a daily list can be generated and recorded for tracking purposes. If a claim ever needs to be resent, just highlight it on the history list, click Undo, and the claim returns to the Waiting to Send status to be resubmitted. DentOffice integrates seamlessly with our clearinghouse, and the Get Reports button brings clearinghouse reports directly in. DentOffice's Image module houses all patient photos, x-rays, scanned documents, as well as images created within DentOffice, such as consent forms, treatment plans, and statements. Digital imaging can be connected directly. Hard copy x-rays or EOBs scanned in, or digital files can be easily imported for patient chart and health record, consult exchange, and insurance billing. When insurance is collected, it must be posted back into the account module. Insurance reimbursement is entered into the claim by a double click, and then enter payment by procedure so that each individual procedure code revenue can be tracked and reported. Once the payment increments and adjustments are entered, the check is created to be collected into today's deposit slip at the close of the business day. Patient payment is equally simple by moving to the patient account's payment button. Payments may be split between family members, credit cards processed, and individual family members' remaining balances viewed in this payment frame. Once entered, all transactions display chronologically, with aging displayed for the front desk's convenience and awareness at checkout. Once again, there are many activities in the action bar to make front desk efficiency simple and largely handled from only this one frame beyond the appointment scheduler. DentOffice has many highly flexible reports available to you and your billing professional in assessing your practice. They're quickly filtered by date range, aging ranges, or when creating marketing analysis reporting. Production reports, payment reports, procedure code revenue, and aging reports are only a click away. DentOffice will serve the needs of your practice completely, without the overcomplication, proprietary traps, expensive training, and annual updates that many other programs compel. This factor alone makes DentOffice, combined with your outsourced billing professional, a fantastically low-stress, highly efficient, and cost-saving choice for streamlining your hectic practice day. DentOffice puts your time and priorities back where they belong, in quality of patient care and relationship. You deserve to be free to dedicate yourself to that endeavor. Let ClaimTech Systems DentOffice Practice Management and your outsourced billing professionals support and free you and your staff to expand your practice to new levels of care and success. Thank you for watching ClaimTech Systems DentOffice presentation.